easily. So it's my pleasure to invite Dr. Mark Clemons to the stage. Dr. Clemons.
How do you follow that? My goodness. Silence. How unusual. Okay. So when I got the invitation to this event, and it says you've been invited to spend an evening with Jack Kitts and Mark Clemons, yet so many of you have come. So why have I been asked to speak at this event? As those of you who know me will tell you, I'm no good at political rhetoric, and I'm certainly not good at political correctness. Thanks, guys. But I think where my skill set comes in is I know who I answer to. So while Jack Kitts may sit down there thinking that I answer to him, there's two bosses I answer to. One of them is my wife, who controls me through fear. My other boss are my patients and their families, who humble me day in, day out, dealing with the realities of this disease. And that's my theme really for tonight, is about reality. And you've heard it beautifully presented by two previous speakers. The reality of cancer, the reality of death, the reality of suffering, the reality of chemotherapy, mastectomies, toxic drugs. This is the real reality. The reality that cancer doesn't just affect the patient, it affects their families and loved ones as well. But there's also the reality, and as Tim alluded to, of my passion, is the passion that we need to improve things now. Not in 10 years, not in 5 years, now. So reality check number one. Cancer is now the leading cause of premature death, not just in Canada, but globally. And as Jack alluded to, and you saw on the news this week, we now have a population where we have more retirees than under 14-year-olds. Cancer is going to become way more common, and we're going to have a lot more people in this room dealing with the realities of it. Now, as my patients know, I invited many of them here, I would like, if you wouldn't be embarrassed, if people could just let their tables know if they are dealing with the reality of cancer now. So, this could be any of us. And this is not like a story on the news where you can turn the television off and walk away from it. This is the reality of cancer, the real people, and a system of which Jack and I are part of that unfortunately I feel at times lets these people down. So, importantly, tonight is about the great things that are happening here in Ottawa and how we're leading the world, trying to change the way that things are done so that, really for the first time, the patient is the center of research. And this is really an extension of the Tender Loving Research campaign, is the Ottawa We Care program that opened about 48 hours ago. I'll talk a bit more about it in a minute, but essentially we have set up a program empowering women to get involved with research for results that change things now. But Christina Addison in the laboratory, Angel Arnaud, who many of you know, the surgeon I work very closely with, we cannot change the world alone. We need your help. Reality check number two. Without funding, research does not happen. And as we've all heard repeatedly, research is what drives improvements in patient care. Without funding, it doesn't happen. We can have as many bright ideas how to improve patient care as we want, but if there's no funding, those ideas will not move forwards. Without your help, we can't do this. We need you. And so, for example, as I talk about political correctness and my terrible things at it, and Jack now begins to cringe as what I'm going to do to him this time. So about 18 months ago, Jack's sitting there, he's had a good meal, he was happy, and of course, okay. So I said to the room, but very pointedly at Jack, there's now an $8 test. Yes, $8. $8. That with appropriate infrastructure support could significantly identify patients who don't need chemotherapy. Up front, $8. Jack and Paula Doran stood up to the plate. And that's why I can continue this conversation, okay? So, with appropriate support from the hospital and amazing work from the pathology department, as of this week, this $8 test will be tested for the first time in the world under the leadership of Angel Arnaud here in Ottawa. Of course, poor Jack's worried about what I'm going to do to him this year. But for me, it's that commitment from the hospital so that we can save patients from the toxicity of chemotherapy if they don't need it. Another example where the hospital has stood up to the plate is the Rethinking clinical trials program. What's that? Well, all of this research tends to generate an awful lot of new treatments, and we're never quite sure which is the best. So, with help from the Center for Practice-Changing Research here in Ottawa with the university, we set about changing the world. It's been tough, it's been difficult, but we've done it, and we now have over 100 breast cancer patients in the Rethinking clinical trials program. This is the largest breast cancer trial that's currently happening in Canada, and it's being led by those of us, here we are, in Ottawa. So Ottawa, again, simple, practical research that changes patient care. So the mantra really is real research for real patients making a real difference. So, as I mentioned, we've now gone public with this website, Ottawa We Care, through the OHRI, the Ottawa Hospital Research Institute, so that we can be answerable to patients to make sure that the work we're doing is changing practice. So, reality check number 1, cancer's increasing. Number 2, research is important. Number 3, patient voices need to be heard. For too long, I've heard patients, quite rightly in the clinic, say to me, how come, despite the millions of dollars that go into cancer research, progress is so painfully slow? And I agree with them. I think it needs to stop, and it's stopping here in Ottawa. Patients and their families deserve better. Research should not be driven around the researchers themselves, their pet ideas, ivory towers, pharmaceutical companies. Research should be driven around the patient. And I'm going to use 3 stories from this room that show how the Ottawa Hospital, the Ottawa Hospital Research Institute, and Ottawa We Care is driving and playing a pivotal role in changing this. So you've seen a visit of Paula. So Paula's sitting over there with young Jeff, her husband. So Paula, like so many people in this great city, and I'm allowed to say that because I don't come from here, it's an amazing city we live in, was planning for retirement. Retirement was around the corner, life was great. Then out of the blue, her life went out of control. Fit and healthy, suddenly ended up in the emergency room, neck pain, early onset paralysis. And I would turn to any man in this room and say, think of this, she was fit and healthy, children have left home, loving husband, this could be any of us. The skill of the spine surgeons meant surgery was quickly performed, and a piece of the tumor was sent to our laboratories, and we were able to analyze it and found out that it was breast cancer. So, when I first met Paula and Jeff, she was in pain and terrified. terrified of the death sentence that lay ahead of her. Well, here we are, Paula and Jeff, 6 years later. I should say 6 years and many clinical trials later, and doesn't she look brilliant? And one of the trials that Paula was involved in was looking at how often do patients with breast cancer in the bone need to receive the drugs. Because traditionally it's given every 4 weeks, and I just didn't buy it. These drugs were too long in the system for this to make sense. And so we did the world's first study looking at, instead of every 4 weeks, let's give it every 12 weeks. Paula was involved in that study, and it's now global standard of care, which means personalized care, reduce the cost to the patient, reduce the cost of the healthcare system, less side effects, and less visits to the cancer center. But more important than that, and Paula alluded to this in the video, is the last 6 years. In the clinic, we've shared many stories, family events, weddings, family reunions, the things that life is made of. So, I'd also like, in a minute, to allude to the fact that the trial that Paula was involved in also affected Gillian's care. The second patient I'd like to talk to is Carol Ann. I don't know if Carol Ann wants to make her presence known, because she normally does. Yeah, that's right. So I'm being extremely polite here. Carol Ann is one of the most feisty people you will ever meet. She came to me, like Paula did, facing the fight of her life. A mother, wife, pillar of society. Carol Ann has political skills that I can only dream of. But through our biopsy studies, again, we were able to show she didn't need chemotherapy. And over the years, Carol Ann, like Paula, has been involved with trial after trial, changing treatment throughout the world. But the reason I'm pointing her out tonight is because Carol Ann, like Paula, giving back, and has been heading a fundraising, throwing rocks at cancer, which I understand is a pun for curling. And she has led, through her work, to the creation of a program dedicated to the treatment of lobular breast cancer. Now, lobular breast cancer is something the vast majority of you in this room will not know anything about. It's the second most common type of breast cancer. It affects 2,000 women a year. And as you know in the clinic, I call it a tenacious little beast. Instead of growing in lumps, it grows in sheets. It's difficult to see on mammography. It's difficult to operate on. And it's difficult to get the right treatment to give for it. But thanks to Carol Ann, her fundraising, Angel and Christina and I are working with colleagues, and in the US and in Europe, to develop the best treatments for patients with this sort of disease. Real people, real research, real results. So interestingly, a week ago, Carol Ann actually came up to the lab to see some of her cells growing. I would ask any of you, if you get a chance once I've stopped prattling on, to go and have a chat with Carol Ann, because it must be the bizarrest concept in the world. Because when you think of your breast cancer, and then you've donated very kindly to Angel Arnaud, and it's growing in the laboratories here in Ottawa. We are sharing these cells, and Carol knows this, across the world. We're helping other people get better treatments for cancer. So, both Paula and Carol Ann continue to enjoy excellent quality of life, and they personify to me what's so great about Ottawa, which is giving back despite the challenges they face. But finally, I'd like to talk about somebody whose identity has been given away several times this evening by Jack and by Gillian herself. So when Gillian first came to me, she was 31 years old, 21 weeks pregnant. Not only terrified for her own life, but terrified for the life of her unborn child. And I would ask anyone in this room who's a parent, grandparent, aunt, uncle, whatever, to take a moment to consider this. I'm sure many of us have those happy moments during pregnancy, the excitement, the anticipation, the fear. But imagine fighting for your life and fighting for the life of your unborn child. But with the skill of this huge, huge team here in Ottawa, we were able to treat it successfully, and as you've heard, Declan isn't here tonight, but he's being with Dad, and really that's all that matters when you're a parent. But also, you may notice 3 young women at the back of the room. Can the 3 young women make them? Where are they? Oh, there they are. Okay. So some of you may notice Hayden's hiding behind there. There she is. So, hi there. Okay. So, you're all wondering why I'm waving at these kids, okay? Because like Jillian, their mum came to our hospital, pregnant, fighting for her life, fighting to save the life of her unborn child. And there she is over there. Because of the care we delivered, 3 absolutely beautiful sisters. So, back to Jillian, because I think the girls are off and running somewhere. Because of the trials that Paula and Caroline were involved with, Jillian's ongoing cancer treatment has become more personalized. Less trips to the cancer center, more time with Declan. And it's given me great pleasure this evening to introduce Jillian to Paula and Caroline, so that Paula and Caroline can see how an involvement with research, they're both mums, is helping another young mum deal with her disease. So, what do I want people to take home from tonight? Yes, I will finish. Okay. Tonight, believe it or not, is not about me. It's not about the care I give. It's not about the research that I do. Tonight is about the reality of cancer. I'd like people to be aware that the Ottawa Hospital, the Ottawa Hospital Research Institute, and Ottawa We Care program are committed to providing leading-edge cancer care and important research that actually helps patients. But that's not enough. As I've said, cancer is now the world's biggest cause of premature death. It's not a time for complacency. And we have a choice. You can either observe what's happening, meet these very nice patients, go home, put this evening behind you, or you can look at these women, look at them in the eye, and you can commit to helping them, realizing that their stories could be any of our stories. And I would say to you before you go to bed tonight, I would like to think of Hayden over there, hiding behind the table. I would like you to think of Declan at home with his dad. I'd love you to look in her eyes, because these kids could just as easily be our kids. They could be our grandchildren, our nieces or nephews. And these kids are alive tonight because of the care that they received here at the Ottawa Hospital, and we were able to treat their mums, keep their disease under control, and allow them to grow up to extremely well-behaved young children. Okay. Look at these kids that could be our kids. Commit to helping the Ottawa Hospital Research Institute. Commit to helping the Ottawa We Care program, so that young Hayden, younger Declan, can grow up, enjoy life, and have the opportunities that the rest of us in this room have had. I think we owe it to these young children to do our best so they can grow up with both parents, both a mum and a dad. We can all make a difference, and ultimately, if you want to make a difference, the choice is entirely yours. Thank you very much.